Hello everyone, and welcome to this video from the American Institute of Personal Injury Physicians. This is Get Yourself Some Sleep. My name is Dr. Scott Tauber, and I will be taking you through this presentation. Sleep disturbance or alteration of sleep patterns or other sleep disturbance is important in personal injury for a lot of different reasons. First, it's important in the healing process. Your patient needs sleep in order to heal, and if they're not sleeping or missing sleep or have a disruption in their sleep patterns, this can start to affect other areas of their life. Now, in addition to clinically, sleep is also important because it's a value and severity driver, and it also plays into the diagnoses that are used later on when the case is being settled. So let's take a look. There's a few things to keep in mind when it comes to sleep disturbance. The first thing is you have to ask about sleep. And when you do, you'll probably see a large majority of your patients do have some form of sleep disturbance or alteration in their normal sleep patterns prior to their injury. Next, attempt to identify it, and you can do this on the intake form and also through your knee-to-knee history. Once you've asked and identified, then attempt to document that into the treatment note, either the initial note or subsequent notes. The next step is to go ahead and diagnose the sleep disturbance. And you can do this two ways, either through ICD-10 or body part diagnoses. Then finally, if needed, you can go ahead and co-manage the sleep disturbance or alteration with a specialist. All of these steps are important to the documentation and the diagnosis and the management of sleep disturbance. As I mentioned, it's very common, and if you go back and take a look at your last 10 personal injury patients, I think you'll find a large majority of them have identified some form of sleeping problems or disturbance. Here are some considerations. Create a form that can document the patient's sleep patterns and any alteration that they've noticed since the accident, collision, crash, or injury. And you can use this like an outcome assessment. Early on, within the first few visits, around every re-examination, and then again at the release. This way you clearly document the frequency and duration of the patient's sleep disturbance, which are an important part of the overall documentation of this particular condition. All right, so here are some specific steps. First, be aware that this is an issue and try to identify it early on, if possible, in the patient's treatment plan. Create a process of attempting to capture the sleep disturbance and the frequency and duration, and then make sure to diagnose it. It does attach to the body part diagnoses, which are used by the evaluation software, and it will help those that are attempting to settle the case if you can go ahead and diagnose it in this manner. There is more to this particular condition, but to keep this short and simple, these are the highlights, and if you can apply this into your cases immediately, you're going to see some improvements. All right, thanks for watching. Please let us know if you have any questions. Feel free to email us at info@aipip.com or at 888-924-7479. We'll see you again down the road on another AIPIP video. Take care, everyone.